We're already in dual crises.
These streets are quiet, but there's another danger beyond COVID-19, a lethal dose of drugs. The novel coronavirus has disrupted the safe supply for users as the opioid and drug crisis continues. And advocates are pointing to health authorities providing their own supply as a solution for those with addictions. Underneath the silence, advocates say there is a second emergency coming as the Canada-U.S. border shutdown halts drug smuggling and supplies run low.
Benzodiazepines are being cut into a lot of opiates right now, and naloxone doesn't work on those benzos. Then we have the added factor that people are less able to use more frequently. So what that means is that tolerance is dropping because they're not using as often. So when they do use, their risk for overdose increases.
They say those addicted to alcohol are also turning to drugs when social supports are breaking down, or without liquor, they're turning to substances to fight painful withdrawals. Speaking over the phone, police say they're watching.
It's way too early to tell that we're seeing any specific changes as it relates to the drug trade and what drugs are here and what drugs are not, or having seen an increase in the price of drugs. These are some of the things that we believe could happen.
But those working in addiction say this is happening now. In BC, the government recently announced a new guidance to provide a safe supply to patients, which can include prescription alternatives. And there are renewed calls for decriminalization in the context of COVID-19. Rangers says the pandemic is shining an uncomfortable spotlight on inequities.
It's probably going to show a lot of really ugly facets of our social support networks.
In Calgary, Crystal Adaris, City News.